can take the pain out of the patient's leg and put it in his back. And I said, yes, that's very common. Because that means that they're no longer a surgical candidate. Yes, 100%. Some people ain't going to like that, is it? The idea that because the patient has pain in the leg, that they are a surgical candidate and need surgery is nonsense, absolute nonsense. A large percentage of patients who have sciatica are rapidly reversible if the right movements are performed on. And so no patient should ever consider surgery of the spine unless they have previously had an extensive examination and assessment by a person trained in mechanical diagnosis and therapy, which is MDT abbreviated, which is the system that I have developed. It's now practiced worldwide in hundreds of countries, dozens of countries. And the pain can be moved without surgery out of the leg. That's a tremendous step forward. Its importance is underestimated, underrated, undervalued, and certainly not considered a good option by orthopedic surgeons. The surgical rate in the United States especially is appallingly high for back pain and leg pain, side pain.
Is there a specific exercise that the patient needs to do or not to do if there's a bulging disc in an MRI, or should a mechanical assessment be the driving force behind getting the patient better?
Yes, you've got it right in the end. There should be a mechanical assessment. But the first thing to do is throw the MRI away. Because they tell lies. They're not always correct. What they show is probably correct, but is that the joint that's causing the problem? Throw the MRIs away and put the patient through a real structured mechanical evaluation. Repeat movements, and repeat movements. What is the effect on the patient? Because if you move them once, it will probably hurt. And they all don't do that. But if you keep repeating the movement, you may find that the pain changes or moves from one place to another or stops. And so if you're going to operate on the patient because of the MRI and you haven't done this, you